Hi, I'm Dr. Magaziner at the Magaziner Center for Wellness in Cherry Hill, New Jersey. And I'm here once again with my new associate, Dr. Lisa Zimmerman, who's a specialist now as well in internal medicine, but also in integrative and functional medicine. Today, I want to just ask Dr. Zimmerman a couple questions about autoimmune disease and thyroid problems. We know the thyroid is so important. It's located over here in the neck, but what are some of the things the thyroid might do, and what are some of the signs and symptoms that someone might have who has a low or underactive thyroid?
Right, so a low or underactive thyroid patient's usually very tired, their brain functions a little sluggish, they just can't quite function on the same level as the rest of us. And a lot of people will get conventional thyroid testing. It'll consist of 2 blood tests, and it really doesn't give them an adequate picture. I found that most conventional doctors are not checking a T3 level or a reverse T3 level. They're not checking antibodies or autoimmune antibody disease of the thyroid. So a lot of these patients are not diagnosed.
Yes, I find a lot of my population has autoimmune antibodies to the thyroid. They're called TPO antibodies, the thyroglobulin antibodies, and they have no idea that they had these things because they were never checked before.
Right.
So, we have to think about also the GI tract when we're dealing with thyroid problems, because that's where some of it could stem. And even all the plastics in the world that we're drinking out of plastic bottles today can play a role with developing autoimmune disease, especially with the thyroid and other what's called endocrine organs. Right.
Sometimes it's linked to even toxins.
Right.
People have been exposed to different toxins can affect their thyroid gland function.
Exactly. So I want to stress the importance of looking at the whole body when we're dealing with underactive thyroid or dealing with autoimmune diseases. It's not just a matter of covering up the symptoms with a pill. It's looking at the whole body and trying to figure out what are some of the different triggers and etiology that might be triggering the problem in the first place. Dr. Zimmerman, I want to thank you so much today. And if you're interested in finding out more about what we can do for your health, just give us a call. Dr. Magaziner, Dr. Zimmerman, we're here for you and we're here to help you. Thanks so much for listening.